How to know if your child has juvenile diabetes. Juvenile diabetes, better known as type 1 diabetes or insulin-dependent diabetes, is a disease in which the pancreas, which normally produces insulin, stops producing insulin. Insulin is important because it's a hormone that regulates the amount of sugar, glucose, in the blood and helps to transfer the glucose to your cells for energy. If your body isn't producing insulin, this means that the glucose stays in your blood and your blood sugar level can become too high. Type 1 diabetes can technically develop at any age but typically occurs in people under 30 years old and is the most common type of childhood diabetes. The symptoms of juvenile diabetes are typically rapid in onset. It's important for juvenile diabetes to be diagnosed as soon as possible because it worsens as time goes on and can result in serious health problems, such as renal failure, coma, and even death. Method 1: Spotting early or presenting symptoms. 1. Keep track of your child's thirst. All the symptoms of type 1 diabetes are a result of hyperglycemia, or high glucose in the body, and the body working to balance it out. Increased thirst, polydipsia, is one of the most common symptoms. Extreme thirst occurs as a result of the body trying to flush out all of the glucose in the bloodstream since it can't be of use, because there is no insulin to escort it into the cells. Your child may feel thirsty all the time, or may drink unusually large amounts of water that are far beyond their normal daily fluid intake. According to standard guidelines, children should drink between 5 to 8 glasses of fluids per day. Young children, ages 5 to 8, should drink less, about 5 glasses, and older children should drink more, 8 glasses. However, these are ideal guidelines, and only you can know how much water and other liquids your child actually intakes on a daily basis. Thus, the assessment of increased thirst is relative to what your child usually consumes. If they usually drink just about 3 glasses of water and a glass of milk with dinner, but now constantly ask for water and other drinks and are drinking a lot more than their usual 3 to 4 glasses a day, this may be cause for concern. Your child may feel a thirst that cannot be quenched even if they intake a lot of water. They may even still appear dehydrated. 2. Notice if your child urinates more frequently than normal. Increased frequency of urination, also known as polyuria, is the body's attempt to filter out the glucose with urination. Of course, it is also a result of increased thirst. As your child drinks more water, the body will produce more urine, resulting in considerably higher incidences of urination. Be especially vigilant about the nighttime and check to see if your child is urinating more than usual in the middle of the night. There is not an average number of times that children urinate a day. This depends on their food and water intake, and so what is normal for one child will not necessarily be normal for another. However, you can compare your child's current frequency of urination relative to his past frequency. If in general, your child went to the bathroom about 7 times a day, but is now going 12 times a day, this is cause for concern. This is also why the nighttime is a good time for observation or awareness. If your child never got up in the middle of the night to pee, but is now up 2, 3, or 4 times a night, you should take them to the doctor for testing. Also look for signs that your child is dehydrated from urinating so much. The child may have sunken eyes, a dry mouth, and a loss of elasticity in the skin. Try lifting the skin on the back of the hand upwards in a tent shape. If it doesn't bounce back immediately, this is a sign of dehydration. You should also pay close attention if your child starts wetting the bed again. This is particularly important if your child has already been potty trained and has not wet the bed for a long time. 3. Pay attention to any unexplained weight loss. Juvenile diabetes commonly causes weight loss due to metabolic derangements linked to increased blood sugar levels. Very often the weight loss is rapid, although at times it may progress gradually. Your child could be losing weight and may even appear emaciated or skinny and weak due to juvenile diabetes. Note that a loss of muscle bulk also often accompanies the weight loss due to type 1 diabetes. As a general rule, unintentional weight loss almost always warrants consultation with a medical professional. 4. Note if your child suddenly has an increase in hunger. The resultant muscle and fat breakdown, along with calorie loss, stemming from type 1 diabetes further leads to loss of energy and subsequent increased hunger. Thus, there is a paradox here: your child could be losing weight even as they demonstrate a noticeable increase in appetite. Polyphagia, or extreme hunger, results when the body attempts to get the glucose that its cells need from the blood. Your child's body wants more food to try to get that glucose for energy, but it cannot. Without insulin, it doesn't matter how your child eats, the glucose from the food will float around their bloodstream and never make it into the cells. Note that there is no medical or scientific benchmark to assess your child's hunger. Some children naturally eat more than others. Keep in mind that children tend to be hungrier when they experience a growth spurt. Your best bet is to measure your child's behavior with their previous behavior to assess whether they seem considerably more hungry than usual. For example, if your child would usually pick at their 3 meals a day but for a few weeks has been eating everything on their plate and even asking for more, this may be a warning sign. If this is accompanied by increased thirst and trips to the bathroom, it is less likely to just be a sign of a growth spurt. 5. Notice if your child suddenly seems fatigued all the time. The loss of calories and glucose required for energy production, as well as fat and muscle breakdown, will generally result in tiredness and a disinterest in normally beloved games and activities. Sometimes children also tend to become irritable and have mood swings as a result of the exhaustion. As with the other symptoms mentioned above, you will need to assess your child's sleeping patterns based on what is normal for them. If they usually sleep 7 hours a night but is now sleeping 10 hours and still complains of being tired or shows signs of being sleepy, slow, or lethargic even after a full night's sleep, you should take note. This may be a sign that they are not just experiencing a growth spurt or a period of tiredness, but that diabetes may be at work. 6. Take note if your child complains of blurry vision. High blood sugar levels change the water content of the optical lens and cause the lens to swell, leading to hazy, cloudy, or blurred vision. If your child complains of blurry eyesight, and repeated visits to the ophthalmologist have been of no use, consult a doctor to rule out type 1 diabetes. Blurry vision usually resolves with the stabilization of blood sugars. Method 2. Tracking late or concomitant symptoms. 1. Watch for recurrent fungal infections. Diabetics have higher levels of sugar and glucose in their blood and vaginal secretions. This is an ideal environment for abundant growth of yeast cells, which normally cause fungal infections. As a result, your child may suffer from recurrent fungal skin infections. Notice if your child seems to be itchy in the genital area. For girls, you may notice that they have repeated vaginal yeast infections, characterized by genital itching and discomfort, with mild white to yellowish foul-smelling discharge. Another type of fungal infection that can be a result of the immune-compromising feature of juvenile diabetes is athlete's foot, which causes white discharge and peeling of the skin in the webs of the toes and soles of the feet. Boys, especially if they are uncircumcised, may also develop a fungal yeast infection around the tip of the penis. 2. Keep track of any repeated skin infections. The reflex that enables the body to fight against infections under normal circumstances is hampered by diabetes, as it causes immunological dysfunction. Increased glucose in the blood additionally causes unwelcome bacterial growth, often resulting in frequent bacterial skin infections such as boils or abscesses, carbuncles, and ulcerations. Another aspect of recurrent skin infections is the slow healing of wounds. Even small cuts, scratches or wounds from minor trauma take an abnormally long time to heal. Be on the lookout for anything that doesn't fix itself up as usual. 3. Watch out for vitiligo. Vitiligo is an autoimmune disorder, leading to reduced levels of the skin pigment melanin. Melanin is the pigment that gives human hair, skin, and eyes color. With the occurrence of type 1 diabetes, the body develops auto-antibodies that destroy melanin. This results in white patches on the skin. Although it occurs much later in the course of type 1 diabetes and is not very common, it is better to rule out diabetes if your child develops such white patches. 4. Look out for vomiting or heavy breathing. These symptoms can accompany diabetes as it progresses. If you notice your child vomiting or overly deep breathing, this is a dangerous sign and you should take your child to the hospital immediately for treatment. These symptoms may be a sign of diabetic ketoacidosis, DKA, which can result in a potentially fatal coma. These symptoms come on fast, sometimes within 24 hours. If left untreated, DKA can be fatal. Method 3. Visiting a doctor. 1. Know when to consult a physician. In many cases, type 1 diabetes is first diagnosed in the emergency room, when children are admitted in a diabetic coma or diabetic ketoacidosis, DKA. Though it can be treated with fluids and insulin, it's best to avoid this altogether by consulting your physician immediately if you suspect your child may be diabetic. Don't wait for your child to pass out for a long time thanks to DKA in order to have your suspicion confirmed. Get your child tested. Symptoms that require immediate medical attention include loss of appetite, nausea or vomiting, a high temperature, stomach pain, fruity smelling breath. Likely you can smell it but your child won't be able to smell it themselves. 2. Visit your physician for examination. If you suspect that your child might have type 1 diabetes, get evaluated immediately. To diagnose diabetes, your doctor will want to request a blood test to assess how much sugar is in your child's blood. There are 2 possible tests, hemoglobin test and a random or fasting blood sugar test. Glycated hemoglobin, A1C, test. This blood test provides information about your child's blood sugar levels over the past 2 to 3 months by measuring the percentage of blood sugar attached to the hemoglobin in the blood. Hemoglobin is a protein that carries oxygen in the red blood cells. The higher your child's blood sugar levels, the more sugar will be attached to the hemoglobin. A level of 6.5% or higher on 2 different tests is indicative of diabetes. This test is the standard test for diabetes assessment, management, and research. Blood sugar test. In this test, your doctor takes a random blood sample. Irrespective of whether your child just ate or not, a random blood sugar level of 200 mg per deciliter, mg, dl, may indicate diabetes, especially if it occurs with other symptoms. Your doctor may also consider taking a blood test after requiring your child fast overnight. In this test, a blood sugar level from 100 to 125 mg dl indicates prediabetes, while a blood sugar level of 126 mg dl, 7 mol L, or higher on 2 separate tests, your child has diabetes. Your doctor may also request a urine test to confirm type 1 diabetes. The existence of ketones, which emerge from the breaking down of fat in the body, in the urine is indicative of type 1, as opposed to type 2. The presence of glucose in the urine also indicates diabetes. 3. Receive the diagnosis and treatment plan. Once the tests are completed, your doctor will use your child's blood test results and the American Diabetes Association (ADA) criteria to diagnose diabetes. Following the diagnosis, your child will need close medical follow-up until their blood sugar has stabilized. Your doctor will need to determine the right type of insulin for your child as well as the appropriate dosage. You will likely need to consult an endocrinologist, a specialist in hormone disorders, in order to coordinate your child's diabetes care. Once the basic insulin treatment plan for managing your child's type 1 diabetes is set, you will need to schedule checkups for your child every few months to repeat some of the above tests to make sure your child's blood sugar levels are satisfactory. Your child will also need to have regular foot and eye exams, since these are often places where the symptoms of poor management of diabetes are seen first. Though there is no cure for diabetes, technology and treatment have developed to such an extent that most children with type 1 diabetes live happy and healthy lives once they know how to manage their diabetes. Tips. Keep in mind that type 1 diabetes, or what used to be known as juvenile diabetes, is not related to diet and weight. If an immediate member of the family, such as a sister, brother, mom, dad, has diabetes, the child in question should be brought to the doctor at least once a year from the ages 5-10 years old to confirm that he does not have diabetes. Warnings. Because many of the symptoms, lethargy, thirst, hunger, of type 1 diabetes are relative to your child, they can be easily missed. If you even suspect that your child shows any of the symptoms or a combination of them, bring him to a doctor immediately. Early diagnosis, treatment, and management of type 1 diabetes is absolutely essential in order to reduce the chances of developing serious complications, including heart disease, nerve damage, blindness, kidney damage, and even death.